Welcome to Season 2, Episode 1 of Elemental Health, the podcast where we explore the fascinating world of holistic well-being. I'm your host, Dr. Michael Murray. I am a chiropractor, certified massage therapist, and a Reiki practitioner who has been in practice for over 20 years. For those of you listening around the globe, we are located in Los Angeles, California. Today's podcast is titled Therapeutic Touch, Demystifying Massage Therapy. So go grab a warm cup of tea, a fuzzy blanket, and your bunny slippers. Find yourself a cozy little spot, take a slow, deep breath, and let's embark on this hands-on journey together. Before we get started, let me give you a taste of what we'll be covering today. We'll begin with the history of massage therapy. And yes, we will even touch on the darker side of that history. Then we'll discuss all the wonderful physical benefits that come with receiving a therapeutic massage. We'll explore the amazing mental benefits that often accompany therapeutic massage. We'll discuss an area people don't often talk about, the emotional component of massage therapy. Then we will discuss what to expect on your first massage and draping of the covers. We'll cover how to find a massage therapist, day spa, app-based service, referral, or something else entirely, and whether it's safe to have a therapist come to your home. We'll discuss everyone's favorite topic, what you should expect to pay, whether to tip and how much, and how to think about add-ons. And we'll turn to the peer-reviewed literature to see what the research actually says about massage therapy. Before we dive in, just a quick reminder, if you're enjoying this podcast, don't forget to subscribe and leave a 5-star review. It helps other people find this important information, gives us higher visibility in searches, and honestly, it also gives me warm fuzzies. Now, let's get into today's topic. Whether you're a potential client, a curious wellness enthusiast, or maybe even considering massage therapy as a career path, this episode is exactly what you need. What is massage therapy? People have asked me, why can't I just have my friend give me a back rub? Well, I'm here to tell you it's so much more than that. Let me paint you a picture. At its most basic level, massage therapy is the systematic manipulation of your body's soft tissues. But saying that is like saying cooking is just heating up food. It completely misses the artistry and science involved. Think of your body as a very complex musical instrument. Just like a piano needs regular tuning to maintain its harmony, your body's tissues need skilled attention to maintain optimal function. A massage therapist is like that skilled piano tuner, knowing exactly where to apply pressure, how much force to use, and which techniques will produce the best results for your specific needs. In today's episode, we're going to cover everything from the fascinating history of massage therapy to the latest scientific research. We'll talk about why that knot in your shoulder keeps coming back, why massage therapy isn't just a luxury, and yes, we'll even address that awkward question about the difference between a masseuse and a massage therapist. But before we go further, I want to acknowledge something. If you're new to massage therapy, you might feel a bit nervous or uncertain about trying it. That's completely normal. By the end of this episode, you'll have a clear understanding of what to expect and how to make the most of your massage therapy experience. A journey through history. Let's begin with a journey through time. Massage therapy has a pretty wild history, and I mean that very literally. Imagine ancient Egypt around 2500 BCE. In the shadows of the pyramids being built, physicians were already using massage therapy to treat their patients. They actually left detailed instructions on papyrus scrolls. Talk about your ancient medical records. You think today's handwritten records are hard to read? Try ancient papyrus records. Meanwhile, in ancient China, medical texts dating from as early as 2700 BCE were describing massage techniques that we still use to this day. The Chinese understood something fundamental, that the body's energy flow, or qi, could be influenced through touch. This foundational understanding would eventually give rise to practices like acupressure and Tui Na, which remain widely practiced today. Moving forward to ancient Greece, athletes would receive massages before and after competing in the Olympic Games. Hippocrates, often called the father of medicine, wrote in the 5th century BCE, "The physician must be experienced in many things, but assuredly in rubbing." Yes, Hippocrates was basically prescribing massage therapy to his patients. It's remarkable to think that the core principle hasn't changed in 2,500 years. The Romans took the Greek tradition and ran with it, quite literally. Roman soldiers received massage after long marches and battles. Julius Caesar himself was reportedly given daily massages to help manage his epilepsy. The great bathhouses of Rome were as much massage centers as they were places to bathe. Fast forward to 19th century Sweden, where a man named Per Henrik Ling developed what we now call Swedish massage, the foundation of most Western massage practices today. His system of effleurage, petrissage, tapotement, and friction gave us a standardized vocabulary and methodology that professional massage therapists still train in. The complicated chapter, 20th century America. But here's where the story gets interesting, and honestly a bit uncomfortable. Let's fast forward to the early 20th century in the United States. This is a part of massage therapy's history that's important to acknowledge openly. During this time, massage therapy faced a serious identity crisis. In some areas, legitimate therapeutic massage became conflated with adult sexual services. This led to a really challenging situation where, believe it or not, all massage therapists, legitimate or not, were required to get licensed under adult entertainment regulations for some time. Prior to 2009 in California, for example, there was no state regulation of massage therapy. All of the regulation was handled at the city or county level, and most of the time it was regulated as adult entertainment. Think about that for a moment. A licensed healthcare professional with hundreds of hours of training in anatomy and physiology, regulated the same way as a strip club. This brings us to an important distinction that still affects our profession today: the terms masseuse versus massage therapist. You might hear these terms used interchangeably, but there's a significant difference. The term masseuse, or masseur, for male practitioners became associated with adult services during that complicated period in massage therapy's history. That's why today we use massage therapist or massage practitioner. It's not just about semantics, it's about recognizing the professional healthcare nature of the work. The creation of the National Certification Board for Therapeutic Massage and Bodywork in 1992, and California's passage of the Massage Therapy Act in 2008, which created statewide licensing through what became the California Massage Therapy Council, were pivotal moments. They drew a clear legal line between licensed healthcare practitioners and anyone operating outside that framework. Modern massage therapists are healthcare professionals who complete hundreds of hours of education. They study anatomy, physiology, pathology, kinesiology, and various hands-on techniques. Today, massage therapy is recognized by major healthcare organizations, including the National Institutes of Health and the American Medical Association, as a legitimate complementary healthcare practice. Even the Department of Defense supports it through the Veterans Administration Program, providing medical massages for wounded veterans. On January 1st of 2026, the California Massage Therapy Council lobbied Sacramento and secured the title for all CAM-TC certificate holders to be officially licensed as healthcare providers. Now let's talk about what massage therapy can actually do for your body. Buckle up, because this is where it gets really exciting. Let's start with the musculoskeletal system. Your muscles, bones, and all that good stuff. This is where massage therapy really shines. First up, chronic muscle tension. You know that tight spot between your shoulders that feels like it's made of concrete? That's chronic muscle tension, and it's one of the most common issues treated with massage. Here's what's actually happening physiologically. When muscles stay contracted for too long, they can get stuck in that shortened position, what we call a hypertonic state. Massage helps break that cycle by physically lengthening the muscle fibers, improving blood flow to the areas being worked, reducing inflammation, and helping your nervous system remember what relaxed actually feels like. People are unfortunately creatures of habit, so unless the activity a person is doing that creates this tight spot between their shoulders is changed, the muscle tightness will likely return in time. We try and educate people why a particular problem area keeps returning. For example, driving with your face close to the windshield and your elbows pointed to the sky as you hold the steering wheel in a death grip is likely contributing to the tightness between your shoulder blades. Now it's time for a quick anatomy lesson. Your muscles are wrapped in something called fascia. Think of it like the casing around a sausage. When you're stressed or injured, this fascia can get sticky and tight, restricting movement. Massage techniques help restore the natural slide and glide between the fascia and the muscles beneath. Being dehydrated can also contribute to fascia stickiness, by the way, so always remember to drink plenty of water, especially before and after a massage session. Now let's talk about circulation. Every time a therapist applies pressure during a massage, they're literally pushing blood through your tissues, like squeezing water through a sponge. This brings fresh oxygen and nutrients to your cells, helps remove metabolic waste, can reduce swelling, and can even help lower blood pressure over time. Story time. I had a client once, let's call her Jane, who came to me with chronically cold hands and feet. After 6 weekly sessions focused on improving her circulation, she noticed a dramatic improvement. Her extremities were no longer icicles. Why? Because regular massage helped improve her peripheral circulation by keeping the capillary beds in her hands and feet more active and responsive. And don't overlook the lymphatic system. The lymph system doesn't have a pump the way the cardiovascular system has the heart. It relies entirely on muscle movement and manual pressure to move fluid through it. A skilled massage therapist using lymphatic drainage techniques can significantly reduce edema, that's swelling, particularly in clients recovering from surgery or injury. Let's move on to the nervous system. When your tissues are massaged, it's not just affecting muscles. It's communicating directly with your nervous system. Your nervous system has 2 main modes: sympathetic, the fight or flight response, and parasympathetic, the rest and digest response. Massage helps switch you from sympathetic to parasympathetic mode. This shift reduces stress hormones like cortisol, increases feel-good neurotransmitters like serotonin, improves the quality of your sleep, and can even help with pain management. Speaking of pain management, let's talk about the gate control theory of pain. When an area of your body is massaged, it creates what we might call sensory noise in your nervous system. That input competes with and helps interrupt pain signals traveling to the brain. It's like turning up the radio to drown out that annoying sound coming from your engine. Except in this case, therapeutic touch is the radio, not death metal. Research shows that massage therapy can be particularly effective for low back pain, neck and shoulder tension, certain types of headaches, symptoms of fibromyalgia, post-exercise soreness, which is why you'll often see a large tent full of massage therapists stationed at the finish line of a marathon, and post-surgical recovery. Here's something important to remember. All of these benefits are cumulative. Just like you can't get super fit from one day at the gym, you typically won't resolve chronic issues with only one massage. That's why I often create treatment plans based on a client's specific needs and goals that span multiple visits. Mental benefits of massage therapy. Now let's talk about what happens in your brain when you receive massage therapy. This is where things get really cerebral. You know that blissed out feeling you get during and after a massage? That's not just in your head. Well, okay, actually it is totally in your head, but it's based on real neurochemical changes. When you receive therapeutic touch, your brain releases an entire cocktail of feel-good chemicals. Serotonin, which helps regulate your mood. Dopamine, which is strongly involved in the brain's pleasure and reward centers. And a plethora of endorphins. Those are the hormones that act as the body's natural painkillers. I had a client who worked as a tax consultant. As we all know, when April 15th rolls around, things get hectic. He came to me initially for neck and shoulder pain, but after a few sessions, he told me something very interesting. He noticed he was handling work stress better, making clearer decisions, and sleeping much better at night. This isn't at all unusual. Research shows that regular massage therapy can reduce anxiety levels by up to 50%, improve concentration and mental clarity, enhance cognitive function, reduce symptoms of depression, and significantly improve the quality of sleep. Let's talk about the stress response for a minute. When you're stressed out, your body releases cortisol. That's the fight or flight hormone. If cortisol levels remain elevated for a significant period of time, this can lead to all sorts of serious problems, from weight gain to memory issues. Chronically elevated cortisol levels have also even been linked to serious chronic illnesses. Massage therapy has been shown to reduce cortisol levels by up to 31%. But it's not just about chemicals and hormones. Massage provides something our modern world often lacks: mindful, present moment awareness. During a massage, you're forced to slow down, to breathe, to just be in your body. In our hyper-connected world, how often do you take an hour to completely disconnect? No phone, no emails, no responsibilities, just focusing on your own well-being. This mental reset is incredibly valuable and increasingly rare. The emotional component of massage therapy. Now let's talk about something that might surprise you: the emotional impact of massage therapy. This is an area that doesn't get nearly enough attention. It is often said that the body keeps score. Every stressful meeting, every argument, every joy, every heartbreak, your body remembers it all. These experiences and the emotions attached to them often get stored in your tissues. The pioneering trauma researcher Dr. Bessel van der Kolk literally wrote the book on this. It's called The Body Keeps the Score, and I highly recommend it to anyone curious about the mind-body connection. I remember a client who came in for low back pain. During the session, as I was working on a particularly tight area, she suddenly started crying. She was surprised by her own reaction, but I wasn't. What she was experiencing is known as emotional release, something I've seen with surprising frequency in massage therapy over my 20-year career. This emotional component of massage therapy can be very helpful for improved emotional regulation, enhanced self-awareness, better body image, increased emotional resilience, a stronger mind-body connection, and a greater sense of emotional balance. It's important to note that emotional release is both completely normal and safe. Sometimes people feel embarrassed about getting emotional during a massage, but there's absolutely no need to be. Your body is simply processing and releasing emotions that may have been stored for a very long time. This is why massage therapists are trained not just in physical techniques, but also in maintaining appropriate therapeutic boundaries and creating a safe, nurturing environment. We know what to do when this happens, and we're honored to hold that space for you. One more thing worth mentioning here. For many people, especially those who live alone or who don't receive regular physical affection, massage therapy provides something even more fundamental: safe, nurturing human touch. Research consistently shows that touch is a basic human need, and its absence can have serious psychological consequences. For some clients, their monthly massage session may be the most caring physical contact they receive. That's a profound responsibility, and one that skilled massage therapists take seriously. Your first massage, what to expect. So now that you understand what massage therapy can do for you, maybe you're thinking, okay, I'm ready to try this, but you have no idea what's actually going to happen when you walk through that door. That's completely normal, and honestly, the uncertainty is one of the biggest reasons people put off their first appointment. So let's walk through it together, step by step. When you arrive, you'll typically be greeted and asked to fill out a brief health intake form. This is not just paperwork for paperwork's sake. It's your therapist's first opportunity to understand your health history, any areas of concern, medications you may be taking, and what you're hoping to get out of the session. Please fill it out honestly and completely. The more your therapist knows going in, the better they can tailor the session to your specific needs. You may be wondering why your therapist needs to know what medications you're taking. It's a fair question, and the answer matters more than most people realize. Certain medications can interact with massage in ways that are important for your therapist to be aware of before they begin. Blood pressure medications are a great example. Many of these medications already work to lower your blood pressure, and massage, particularly a deeply relaxing session, can lower it further. For most people, this isn't a problem, but for someone on certain blood pressure medications, standing up too quickly at the end of a session can cause a sudden drop in blood pressure that leads to dizziness or lightheadedness. Knowing this in advance allows your therapist to bring you out of the session more gradually and remind you to take your time getting up from the table. Pain medications present a different but equally important consideration. If you've taken a prescription pain reliever, an opioid, or even a strong over-the-counter medication before your session, your body's ability to accurately signal discomfort may be significantly reduced. Pressure that would normally feel too intense may not register the way it should, which means your therapist could inadvertently work too deeply without either of you realizing it, potentially causing soreness, bruising, or tissue irritation that doesn't become apparent until the medication wears off. This is not about judgment, it's simply about keeping you safe. Blood thinners are another medication worth mentioning. Clients on anticoagulants like warfarin or certain newer blood thinners can bruise much more easily than the average person, which means techniques that would be perfectly appropriate for most clients may need to be modified for you. The same principle applies to topical medications, hormone patches, and certain skin treatments. Your therapist needs to know where they are so those areas can be avoided entirely. The bottom line is this: Your therapist is not asking about your medications to be nosy. They are asking because they are a healthcare professional who wants to deliver the safest, most effective session possible. When in doubt, mention it. There is no such thing as oversharing on a massage intake form. Your therapist will then take a few minutes to review the form and have a brief conversation with you, what we call an intake consultation. This is your opportunity to mention that nagging left shoulder, the low back pain that flares up when you sit too long, or the fact that you absolutely cannot stand having your feet touched. Speak up. This is not the time to be polite and quiet. Your therapist genuinely wants to know. Now, and I want to spend a little extra time here because this is the part that makes a lot of first-timers nervous. Let's talk about undressing for the massage. Your therapist will show you to a private room, explain how the session will flow, and then step out and give you plenty of time to undress and get settled on the table. Here is what I want you to hear clearly. You undress to your comfort level, and your comfort level is the only level that matters. That might mean undressing completely. That might mean keeping your underwear on. It might mean keeping most of your clothes on. All of those choices are completely valid, and a professional therapist will never make you feel otherwise. I want to say this especially plainly for anyone who may be feeling anxious about this. You do not have to be naked, ever. There is no rule that says you must remove all of your clothing to receive a therapeutic massage. Some modalities, like sports, Thai, and shiatsu massage, are performed entirely with the client fully clothed. Others work best with direct skin contact, but can absolutely be adapted. You are always in control of your own body. A good therapist will work with whatever you're comfortable with. Now let's talk about draping, because proper draping is one of the most important professional standards in massage therapy, and you deserve to understand it. Draping refers to the way your therapist uses the sheet and blanket on the table to keep you covered throughout the session. Here is the standard. Only the area of the body being actively worked on is uncovered at any given time. If your therapist is working on your back is exposed. Everything else remains draped. When they move to your legs, the back is recovered before the leg is uncovered. At no point should your gluteal region be fully exposed without your explicit prior consent. And even then, only when there is a clear therapeutic reason for it. The chest and breast area on female clients remains draped at all times, with no exceptions. Proper draping is not just a courtesy. In most states, it is a legal requirement. If you are ever in a session where you feel the draping is not being maintained professionally, you have every right to ask your therapist to adjust it, and you have every right to end the session. A legitimate, licensed professional will never make you feel uncomfortable about this. One thing many first-timers don't realize until they climb onto the table: most professional massage tables are heated. There will typically be a heating element built into the table itself, or a heated pad placed underneath the fitted sheet. This is one of life's small but genuine pleasures. Climbing onto a warm table, settling in, and feeling your muscles begin to release before the therapist has even touched you. If the table feels too warm or not warm enough, just say so. Your therapist can adjust it. You'll also likely notice music playing softly in the background. The classic choice is what most people think of as spa music. Slow, ambient, instrumental tracks, often with nature sounds woven in. The purpose is simple. It masks ambient noise from outside the room, gives your mind something gentle to rest on, and helps signal to your nervous system that it's time to downshift. If you find that music distracting, or if you'd prefer something different, silence, classical music, instrumental jazz, acid punk, whatever works for you, just ask. Most therapists are happy to adjust. The room will typically be dimly lit. Bright overhead lighting is counterproductive to relaxation, so expect soft, warm light, often just a lamp or two, or sometimes candles. The room temperature is usually kept comfortably warm, since your body temperature can drop when you're lying still and undraped. Your therapist will typically begin with lighter, warming strokes to acclimate your body to their touch and to get a sense of your tissue quality before working more specifically. They will check in with you about pressure. Please answer honestly. Saying "that's fine" when it actually isn't doesn't serve you. Therapists genuinely want real feedback, and the best ones will ask multiple times throughout the session, since most people can accept more pressure on their back and less on their arms and legs. At the end of the session, your therapist will quietly let you know you're done and step out of the room, giving you time to reorient. Get dressed at your own pace and rejoin the world. Don't rush this. Take a moment. Drink some water. Your therapist will almost certainly remind you to do this, and there's a real physiological reason for it. Massage mobilizes metabolic waste from the tissues, and hydration helps your body flush it out. You may feel slightly lightheaded when you first sit up. This is normal and passes quickly. You may feel deeply relaxed, almost sleepy. You may feel energized. Everyone responds a little differently. What most people agree on is this: they wish they hadn't waited so long to try it. How to find the right massage therapist. All right, so you're convinced. You want to try massage therapy, or maybe you already get them and you're looking to upgrade your experience. Either way, let's talk about how to actually find a great therapist, because not all options are created equal. Day spas are probably the most common first stop for people new to massage, and there's a lot to like about them. They're easy to find, easy to book, often offer a full menu of services, and many have a lovely ambiance that puts you in a relaxed state of mind before you even get on the table. However, I want to be candid with you about something. Day spas vary enormously in quality, some catering to the celebrity clientele, and others are in a strip mall nestled between a pet food store and a barber shop. Some employ highly trained and experienced therapists. Others, particularly the large franchise chains, may employ therapists who have met the minimum licensing requirements and not much more. The business model of a high-volume spa doesn't always support the kind of individualized, clinically focused care that a therapeutic massage really should provide. If you go the spa route, here's what I recommend. Call ahead and ask specifically about the therapist's training and specialty areas. Ask if they have experience with your particular concern, whether that's chronic back pain, sports recovery, fibromyalgia, or anything else. A spa that takes pride in its practitioners will be happy to answer these questions. One that gets evasive should give you pause. In my professional opinion, a personal referral from a friend or family member remains one of the best ways to find a quality massage therapist. When someone you trust says, "This therapist changed my life," that's meaningful. They've already done the vetting for you. They can tell you about the communication style, the pressure level, the attention to their specific issues, things you simply can't learn from a website. Online reviews are the next best thing. Yelp, Google reviews, and health grades are your friends here, but read them critically. Look for patterns, not just star ratings. A therapist with 50 reviews that all mention "great for neck pain" is probably actually great for neck pain. Be a little skeptical of a profile with 3 glowing 5-star reviews and nothing else, and always verify that the therapist holds a current, active, and in good standing license before booking. In California, you can verify a CAMTC certification at camtc.org. Now let's talk about the on-demand massage apps, the ones that work kind of like ordering a rideshare car. You open an app, request a massage, and someone shows up at your door within the hour. Services like Soothe and Zeal are the most well-known in this space. I'll be honest with you, I have mixed feelings about this model. On one hand, these platforms do require their providers to hold valid licenses, and they conduct background checks. The convenience factor is undeniable, particularly for people with mobility issues or demanding schedules. And many excellent, fully qualified therapists work through these platforms. On the other hand, the rideshare model creates some inherent tensions. You're often matched with whoever is nearby and available, rather than selecting a therapist whose specific training and specialties match your specific needs. The pricing structure can also push therapists to rush through appointments to maximize their income, and you lose the therapeutic consistency that comes from building a long-term relationship with one practitioner who knows your body, your history, and your goals. If you use an app-based service, I'd encourage you to pay attention to the individual therapist's profile and reviews within the platform, not just the platform itself. When you find someone you like, both of these apps allow you to mark the therapist as a favorite. This means that when you next request a massage on the app, the request will go only to that person. If a certain amount of time elapses without a reply, only then does your request get pushed out to all available therapists, and you have the option to decline without being penalized with any cancellation fee, as long as you haven't accepted the pairing already. Should you have a therapist come to your home? This is a question I get asked a lot, and it deserves a thoughtful, nuanced answer. From a pure comfort standpoint, in-home massage has obvious appeal. You don't have to drive anywhere or do your hair, or even put on shoes for that matter. You can even roll straight into bed afterward. You're in your own space and likely have the perfect massage soundtrack all ready to go. For people with mobility challenges, for new mothers, for clients recovering from surgery, in-home massage can be genuinely ideal. But I want to be real with you about safety for both clients and therapists. If you're bringing someone into your home whom you've never met, do your due diligence first. Verify their license. Use a reputable platform or agency that conducts background checks. Both Soothe and Zeal do. Tell a friend or family member about your appointment, who's coming, when, and for how long. Keep your session in a common room the first time, rather than a bedroom. These aren't paranoid precautions, they're just smart ones. Massage therapists also take very similar safety precautions when doing in-home visits themselves, and a professional will appreciate rather than resent a client who is thoughtful about security. Massage therapists share a mutual interest in keeping every session safe, comfortable, and professional. For someone brand new to massage therapy, I almost always recommend going to the therapist first. Whether that's a private practice, a chiropractic office that incorporates massage, or a reputable spa. Going to an established location your first time gives you a baseline for what a professional session looks and feels like. Once you have that reference point, you'll be much better equipped to evaluate other options. The bottom line on finding a therapist: take it seriously. Your massage therapist will have significant access to your body, your health history, and in many cases, your emotional state. That warrants the same kind of care you'd take when choosing any other healthcare provider. What should you expect to pay? And do you tip? All right, here it is. Everyone's favorite topic. Let's talk about money. What should a massage actually cost? Should you tip? If so, how much? And what about all those add-ons on the menu? Let's break this down clearly. Massage pricing varies significantly based on where you live, what kind of setting you're in, and the therapist's experience level. So let me give you some general frameworks rather than hard numbers, because the ranges are genuinely wide. In a major metropolitan area like Los Angeles, San Francisco, New York, or Chicago, you can generally expect to pay anywhere from $80 to $180 for a 60-minute massage, and $120 to $250 or more for a 90-minute session, depending on the setting. In smaller cities or rural areas, those numbers will typically run 20 to 40% lower. I just looked up the non-member prices for both a high-end, non-hotel day spa and a popular mobile app provider. 50-minute massages at the high-end spa are going for $180, and an 80-minute massage has a price tag of $245. The popular mobile app pricing has a non-member price tag for a 60-minute massage of $140, and for an hour and a half, it's $190. I charge $160 for an hour massage, $220 for an hour and a half, and most of my add-ons are $30 each. I spent a great deal of time researching these prices. They are right in the middle between a mobile app price and a luxury day spa that has whirlpools, steam rooms, saunas, and beautiful waiting lounges that make you think you are in Wayne Manor. I do have a 600 square foot ADU that is specifically designed to be a massage and chiropractic clinic, complete with waiting area, shower, an 80-gallon freshwater aquarium, and JBL surround sound. I also have 20 years experience as a personal injury chiropractor, so I have 2 decades of massaging some pretty broken people, as well as a portfolio of celebrity clients. So being in the Los Angeles area, I can confidently say that I am worth every penny. There's nothing wrong with going to a very high-end day spa, but it's worth understanding that you're actually paying for the environment as well as the massage. Private practice therapists and chiropractors who offer massage tend to fall in the middle of the range. You're typically getting more clinical expertise and more personalized attention here than at a high-volume spa. Oh, the tipping question. This comes up constantly, and I want to give you a genuinely helpful answer rather than a vague, "it depends." Here's the general rule. If you're at a day spa, a hotel spa, or using an app-based service, you should tip. The standard is 18 to 20% for a good session, and 20 to 25% for a truly exceptional one. Massage therapists at spas and through apps are typically paid a percentage of the session fee, often in the range of 40 to 60%, and tips are a meaningful part of their income. Tipping in this context is not optional in the same way that tipping your barber or your restaurant server is not optional. It is culturally expected and economically important to the person who just spent an hour focused entirely on your well-being. However, and this is an important however, if you are seeing a therapist in a private practice setting, particularly one who owns their own business and sets their own rates, tipping norms are different. Many independent practitioners build their full compensation into their session fee and genuinely do not expect or require a tip. Some even have a policy against accepting them. When in doubt, it's perfectly appropriate to simply ask, "Do you accept gratuities?" Any professional will give you a straight answer. Also, you should not tip if the massage is a medical massage. This falls into the category of physical therapy, and you wouldn't be expected to tip your physical therapist, would you? One more note on tipping. Tip in cash when you can. Credit card tips processed through a spa's system often have a processing delay and sometimes a deduction. Cash goes directly to your therapist immediately. It's a small thing, but it makes a real difference. If your spa has you tip at the counter when settling your bill by putting the tip in an envelope and writing the therapist's name on the envelope, I can assure you the therapist will get every cent of it. At least they did in the luxury day spa where I worked. Add-ons, are they worth it? Now let's talk about add-ons, because every spa menu seems to have a long list of them, and it can be genuinely confusing to know what's worth the extra cost and what's just upselling. Deep tissue work is probably the most commonly requested upgrade, and in many cases it's not actually an add-on at all. It's a technique that a qualified therapist can and should apply to specific areas during any session if it's warranted. That said, some spas do charge extra for it, typically $10 to $25 more per hour, or adjusted up for a 90-minute massage. If you genuinely have chronic tension or adhesions that need more intensive work, it can absolutely be worth it. Just know that deep tissue does not mean painful. More pressure is not always better, and a good therapist will check in with you throughout. Hot stone massage is a legitimate therapeutic modality where smooth, heated basalt stones are used to warm and relax the muscles before and during the massage, allowing the therapist to work more deeply with less direct pressure. It's particularly wonderful for people who carry a lot of tension but are sensitive to firm pressure. Expect to pay an additional $20 to $40 for a hot stone upgrade. In my view, it's one of the more worthwhile add-ons on most spa menus, and once you experience it, you will likely become addicted to receiving a hot stone treatment every time. Aromatherapy involves the use of essential oils, either diffused into the room, applied to the skin diluted in a carrier oil, or both. Lavender for relaxation, eucalyptus for clearing, peppermint for energy, bergamot for mood. Essential oils do have real physiological effects when used properly. The add-on cost is typically modest, in the range of $10 to $20, and for many clients, the olfactory experience meaningfully enhances the session. Just be sure to mention any sensitivities or allergies before your session. CBD oil has become enormously popular as a massage add-on in recent years. The theory is that topically applied CBD may have anti-inflammatory and analgesic properties, and some clients do report noticing a difference. The research on topical CBD is still emerging, so I'll be transparent. We don't yet have the same body of peer-reviewed evidence for topical CBD that we have for the other modalities I've described. That said, I have had clients who swear by it, particularly for localized joint pain. The add-on cost varies widely, anywhere from $15 to $50, so it's worth asking specifically what you're getting and whether the therapist can explain how they use it. I'd lean toward recommending it as an occasional experiment rather than a routine upgrade until the research catches up. I did notice my hands and wrists would not hurt so much after 4 hours of massage if the clients requested CBD oils. Also, a good therapist will mix the CBD into the carrier oil in front of you. A few other add-ons you might encounter: scalp massage, foot scrubs, cupping therapy, and stretching sessions. Cupping in particular has a legitimate therapeutic history and can be very effective for certain types of muscle tension and restricted fascia. It will leave temporary marks on your skin that typically fade within a few days. This is normal and expected. Make sure you go back and listen to Season 1, Episode 3, Cupping Demystified, for a much more in-depth discussion of cupping. My overall advice on add-ons: focus first on getting a great base massage from a skilled therapist. The most important variable in your experience is not the hot stones or the CBD oil. It's the quality and attentiveness of the hands doing the work. Once you've established a relationship with a therapist you trust, then explore the add-ons together based on your specific goals and any therapeutic need. What the research says: Now it's time to get a little bit nerdy and look at what the research says about massage therapy. As a healthcare practice, massage therapy has been extensively studied. A 2014 meta-analysis published in Pain Medicine looked at multiple studies involving over 500 participants and found that massage therapy significantly reduced pain in people with various chronic pain conditions. The Touch Research Institute at the University of Miami School of Medicine has been particularly active in this area. Their studies have shown that massage can reduce pain in fibromyalgia patients, improve immune system function, decrease symptoms of depression, lower anxiety levels, and improve sleep quality. For athletes, research shows massage can reduce the onset of delayed muscle soreness by up to 30%, improve range of motion, enhance recovery time after intense exercise, and reduce inflammation markers in the blood. A 2012 study published in Science Translational Medicine found that massage reduces inflammation and promotes mitochondrial biogenesis. Basically, it helps your cells produce more energy. That's pretty remarkable. Medical applications are also particularly exciting. About 50% of my current clients come to me for what I would classify as medical massage, meaning massage that is part of an integrated treatment plan for a specific health condition. Research has shown massage therapy can reduce post-operative pain in surgical patients, improve outcomes in cancer patients, help manage chronic conditions, and reduce symptoms in patients with autoimmune disorders. One population I'm especially passionate about is providing medical massage for wounded military veterans. I have heard from veterans themselves about experiencing better sleep, reduced pain, lower anxiety levels, and in some cases, fewer nightmares. When a practice that has roots going back thousands of years is still generating meaningful scientific evidence in the 21st century that tells you something important. Conclusion. Okay, we've covered a lot of ground today, from ancient history to modern science, from physical benefits to emotional healing, from how to find a therapist to how much it should cost. If you're considering trying massage therapy, here are some key things to remember. Always choose a licensed, certified professional. In California, verify CAMTC certification online. This protects you and supports the integrity of the profession. Be open with your therapist about your health history and your goals. The more they know, the better they can help you. Be consistent. Massage therapy works best when it's part of a regular wellness routine, not just an occasional treat. Think of it as maintenance for your body. Listen to your body and give feedback to your therapist. Every body is different. What works beautifully for one person may need adjustment for another. Don't let price alone guide your decisions. The most expensive session is not always the best, and the cheapest is not always the worst. Do your research, read reviews, and get referrals. And if you're using a spa, tip 18 to 20%. If you're seeing an independent practitioner, ask about their preference. After 20 years in this field, I'm still amazed by the power of therapeutic touch. Whether you're dealing with physical pain, mental stress, emotional challenges, or a specific medical need, massage therapy can be a genuinely valuable tool in your wellness toolbox. And remember, because your body keeps the score, take care of it. If you have any topics you'd like me to cover in future episodes, or any questions about today's episode, please reach out through our website at mcmelementalhealth.com or through our social media on Facebook or Instagram. Links are at the bottom of every page of our website. This episode of Elemental Health was brought to you by MCM Elemental Health. therapeutic care that transcends, make sure you visit our extensive website at mcmelementalhealth.com for more information on a wide variety of alternative healthcare topics. This concludes this episode of Elemental Health. I'm Dr. Michael Murray. Thanks for listening, and don't forget to like and subscribe.